Welcome to Jersey Matters. I'm Larry Mendte. On this week's show, Rik Mehta, who is the leading contender to take on Cory for the U.S. Senate in the fall. And big changes are coming to Route 18 in East Brunswick, and the mayor there couldn't be prouder. He's here to talk about it. Governor Phil Murphy had his budget address. He is still looking for that millionaire's tax. We'll have a report. And sending your kids to school with the laundry, and it comes back clean. We'll tell you what's going on. And now our interview with Rik Mehta, Republican candidate for U.S. Senate. Sir, thank you so much for being here. I appreciate it.
Oh, it's my pleasure. Thanks
as we do always when we meet a candidate for the first time, if you want to take a minute just to talk about yourself and introduce yourself to the viewers and to the voters.
Yeah, absolutely. Well, thanks for having me. So my story, my family story, actually started 50 years ago when my father immigrated to this country. And it's a great story. He came here with only $100 in his pocket, flew into JFK, took a bus to Scranton, Pennsylvania, opened up a phone book, looked for an Indian-sounding name, called it, and they took him in. He had $100 in his pocket. They took him in, gave him a hot meal and a bed, and the rest was history. And so I started my career as a pharmacist. I went to Rutgers University School of Pharmacy. Very proud of that because that's where I met my wife. Chased her for 10 years until she finally decided to marry me. And from there, I worked at Robert Wood Johnson Hospital, worked overnights, put myself through law school at Rutgers Newark, and where I then went to the FDA. I fought against pharmaceutical companies, trying to fight the opioid epidemic, took millions of illegal opioids off the market, and then came back, started businesses, worked in the private sector, and been fortunate to live the American dream ever since.
So I heard some key words in there. I heard pharmaceuticals, I heard medical, I heard FDA. I would imagine the centerpiece of your campaign is going to be healthcare?
Absolutely. We have to work to fix our healthcare system. And you heard the president speak the other night at the State of the Union. You know, we need to not just fix the healthcare debate, we need to end the healthcare debate. But more critically, people are living paycheck to paycheck because they're unable to afford their prescription drugs. And drug pricing has gotten out of control, and we need to work together collectively. You know, this is looking at the pharmaceutical companies, looking at the prescription drug managers, looking at the supply chain and the wholesalers and where the costs are increasing. That's important because it's really affecting people and their ability to live. And my campaign slogan is actually called Jersey Proud, because I want to make sure that we focus on the things that matter to New Jerseyans and make New Jersey a place to live, not leave.
It seemed like in the midterm election, healthcare became a Democratic issue because Obamacare, it sounds like, was more popular, especially in New Jersey, than was thought. What type of system would you vote for? What are you looking at? I mean, I know the range is wide, from Medicare for all to just repealing and replacing Obamacare and coming up with something new. Where do you stand?
Yeah, well, the Democrats keep making health care an issue because they're trying to expand programs that are intended for actually seniors and most vulnerable populations, right? So if you add for all to every program, you're going to bankrupt us, and that's unacceptable. Medicare
so let's eliminate that. What then?
So we need to start to untangle the regulatory mess that the Affordable Care Act has created. We need to stop the redundant regulations that are crushing our healthcare system and our infrastructure. So we need to reduce the regulatory burden that's been created, and we need to untangle that mess. That's the only way. Now that's costing us billions of dollars.
I didn't hear you say how, though. I mean, so what do you propose, or what are you supporting? Do you support the repeal and replacement of Obamacare, or is that dead?
Well, we're not going to, look, what we need to do is fix and work within the system. We need to reduce the regulatory burdens. Now, let me tell you more specifically, when you look at credentialing for doctors, they waste billions of dollars trying to go through every single insurance company to try to get credentialed. The real issue right now is the lack of transparency in our network system. I'll tell you a personal story. When my wife was pregnant, now this was, by the way, one of my proudest moments. You know, I became a father on July 10th, 2013. My son was born. But, there were some complications. and she needed anesthesia. Well, the anesthesiologist was out of network. Now, how are you supposed to know that in the moment of delivery? And then we were slapped with the $10,000 bill. These are the things that I'm talking about where there's a lack of transparency in the system.
That's an enormous loophole. The out-of-network people that show up and are on your bill that you weren't expecting, and it's one of the highest cost, and it's a problem across the country. And there was legislation, and state by state are handling this. Is there? I don't think the federal government has tackled it yet, have they?
Well, that's what we need to work on. And that's exactly what the president needs a partner to do. Now, if we don't start to tackle those costs and those, the lack of transparency in the system, then we're going to continue to see our premiums climb. And so touting a Medicare for all is only going to hurt the quality of our healthcare system.
I'll say now, twice now, you said the president in his State of the Union, you support something he's doing, and you just said, I want to partner with the president. If you get the nomination and you win in 2020, you're going to be running on a ticket with Donald Trump. Donald Trump has about a 37% favorability rating in New Jersey, and many more people are registered Democratic than Republican. Sure. How do you fight that? Especially if you're saying, I'm going to partner with Donald Trump.
Well, let me tell you something about that, right? So while there is more Democrats registered than Republicans, there's more 2.4 million unaffiliated voters. Now, I told you my story started 50 years ago when my father immigrated. We are tackling and tapping into new demographics. Now, one of the historical parts about this race, we've never had a minority run on the Republican ticket. And I'll tell you, the Republican Party is very welcoming with that. Now, you see the cast of candidates on the presidential side for the Democrats. Do you see any minorities in there?
Not anymore. They started off that way, to be fair. They had a very diverse crowd starting off. But
well, what happened?
It's been winnowed down.
Well, my point is that the New Jersey Republican Party has embraced that. We've embraced that. We're running a very historical race that's never been had before, and there are many new demographics. Now, I've been so fortunate being out on this campaign trail. I've met great guys. One, for example, Frank Knieve. He's a gentleman.
We did a story on Frank Knieve.
Yeah, he's a gentleman who has a condition, cerebral palsy, but that disability doesn't stop him, and he's one of my policy advisors.
He is in the control room right now. Maybe we can get a shot of him and show it during this. We'll put him up from our story.
Well,
we know exactly who you're talking about. He's a wonderful human being.
And you have other minority groups, the Indian American, the Filipino Americans, and many others that have the same conservative principles. At the end of the day, we just want family values to be put forward when you're thinking about passing new legislation. And I think that message is really starting to resonate because many people haven't felt necessarily represented by these, but they hold the same ideologies.
It's amazing we went through this entire conversation and didn't talk about Cory Booker yet, and we're running out of time.
Yeah.
And you've won some of the chairs, right?
I've been fortunate to win the endorsement of Somerset County, Union County, and Hunterdon County to date. And so the GOP party has embraced me as the front runner.
So at this point,
race.
yeah, that's what I'm going to say. You are the front runner. Do you expect anybody else to get in the race?
Not that I don't think so. And I'll tell you what.
There's nobody you're worried about that's out there.
I'm focused on getting Cory Booker out in 2020. Now, he just launched his website pretending he cares about New Jersey. He has not been in he hasn't even been in the Senate, never mind the state of New Jersey. Now he wants to pretend he cares about New Jersey. So let me tell you right now, the people of New Jerseyans are not dumb. It doesn't matter if you're Democrat or Republican. They know when they see someone who's inauthentic and disingenuous, and that's Cory Booker. People are begging for authentic leadership back in public service.
There it is. Thank you.
Thank
I appreciate you coming in. Dr. Rik Mehta for Senate, challenger to Cory Booker, but first he has to win the Republican nomination. If you drive Route 18 through East Brunswick, there's some big changes coming. The mayor is here to talk about it. That's next on Jersey Matters.